What's called a public health crisis here in southern New England. Prescription drug addiction. This spring alone, 5 people brought to Kent Hospital died from overdoses. In just 8 weeks, it's now the leading cause of death for people under the age of 50 nationwide. Part of the problem? Doctor shopping and a lack of communication between drugstores. NBC10's Katie Davis digs deeper now into why this is such a problem tonight. Katie?
It's dangerously easy.
Stephanie Picher would know. She's been clean for more than 2 years after battling a crippling addiction. It started with a single prescription for painkillers after a routine surgery.
My addiction was pretty much turned on right away.
When the pills ran out, she quickly found ways to get more.
Just pushing it up, very, very quickly and with really no ceiling. As much as I could get, it was as much as I could take.
So how was she able to get more and more pills without anyone finding out? Some narcotic addicts use fake identities or steal prescription pads from doctors. But Stephanie says she never had to go that far. Instead, she saw at least a dozen different doctors, dentists, and other healthcare providers, then filled prescriptions at pharmacies all over southern New England, paying cash.
The month-long prescription they would give me was something that would last, 5 or 6 days, and then it was back to the, whatever ER I hadn't already gone to, or back to, whatever doctor I hadn't seen yet.
For months, she filled prescription after prescription, no questions asked.
What's wrong with the Rhode Island system right now?
I have no way of checking to see whether or not the patient is already receiving narcotic medications from another physician.
Dr. Stuart Gitlow is an addiction psychiatrist who treats people in recovery.
I should be able to easily look up in a system to see what prescriptions has the patient been filling.
But for years, there's been no way to do that. Rhode Island and Massachusetts do keep records of all prescriptions updated by pharmacies every 30 days. But there's no way for doctors or pharmacists to access those records online. That means someone first has to suspect something, then call the health department to check.
If the pharmacy does not make the effort to call, then really there's no way to track you because it's not on the web yet. It's not live.
Pharmacist Chuck Rossi has been running Fred's Drugs in Cranston for decades. Pharmacists here look for red flags, like a customer paying cash for narcotics or trying to fill prescriptions from out of the area. But he says addicts still find ways to game the system. And there's another problem. Prescription records in Massachusetts and Connecticut aren't talking with records in Rhode Island. And that means getting multiple prescriptions could be as easy as crossing the border.
States are all collecting data. It's just that the data has not been collaborated.
Stephanie says one pharmacist finally realized something was up, but the confrontation only came after months of doctor shopping.
He said, you've got a prescription that hasn't expired yet from another pharmacy, and I just booked it out of there before anything could happen. I said, oh, it must be a mistake.
She moved on, buying drugs like Vicodin and oxycodone on the street, losing the trust of her family and friends before she finally sought help.
These drugs are really a silent killer.
Dr. Alan Gordon at Butler Hospital has treated Stephanie and dozens of other patients addicted to prescription drugs. He says in many ways narcotics are more dangerous than street drugs.
You don't have hangovers, you don't feel lethargic, you don't notice that your brain is resetting.
Stephanie is now attending college and says her life is back on track. She decided to speak out, hoping others will get help and the loopholes she used will be closed.
I think that it really could save lives.
And while working on this story, we learned that Rhode Island's health department is now working on a new drug monitoring program. They tell us it will better connect pharmacies, doctors, and hospitals. Coming up, we'll show you what's being done and why it has taken so long. Live in the studio, Katie Davis, NBC10 News.